It's that time of night, time for our next Daily Viewpoint. It's called this concept of compassionate use. But one family's finding out it can be anything but compassionate. Josh Hardy is dying in an intensive care unit in Memphis. There's a drug that can save him, but it hasn't been approved by the FDA yet. He could still get access to this drug under something called compassionate use, but the drug company is saying no. Company claims that giving Josh the drug would open the floodgates. First off, the company would have to foot the $50,000 bill for the drug, okay? And the time it takes to review other requests for that drug would delay its availability on the market. So what if it was your child? Okay, there's a lot about this that I have several more questions, but let's just take what the drug company is saying at face value.
What's the delay? I want to know the delay. Is it a year? Is it a few months? What is it? Mm-hmm. And the $50,000, the family and friends have already started one of those campaigns on the web to raise the money. Yeah. But right now, I think this company looks cold-blooded, and I think they're going to take some awful hits on Twitter. They are, because, I mean, save one child. What if it was the child of one of the owners of that company? Don't tell me they wouldn't give them that medication. Right.
But if it's going to delay this product being available to everybody else, again, how long is it going to take? Do we save one child, or do we risk the lives of many? You know, I'm being the devil's advocate here.
Well, no, and that's what they're saying, Iola. They're saying that if they have to start taking all of this time to process all, if we let this kid do it, then everybody else is going to want this drug, and then we won't be able to get it out to the rest of the public. Do you buy that?
I don't understand it. Yeah, that's for sure. But you know, do you sacrifice one to save many? Is the key question here. And I know if it were my child, I'd say you darn well, you know, want to save this individual. But you know, you've got to think of what's in the best interest, I guess, of the majority of people. Now let me
play devil's advocate, and Rebecca, I'll go back to you on this one. What if the company isn't looking at the dollars and cents that it would have to administer this, all the administrative costs just to give this child this drug? What if they're thinking that it would cut into their bottom line once the drug is released?
That's a strong possibility. Yeah. I mean, you got to take all that into consideration. But in the end, I'm telling you, if the company owner's kid had this problem, they would be feeding that child medication. And I'm just saying, also, you know, in order to give it to the FDA to test, they have samples. Why not give them some of those samples for now? And that's not saying stop the testing. I just think in this situation, the company's coming up with excuses. We need to know the delay.
There's got to be a way somehow to make an exception so we don't have to sacrifice this child. I don't understand. You know, there must be a lot more to the story than we know.
Wouldn't we know more if, let's say, Ola, that this community comes up with, let's say, not 50 grand, but 100 grand, and says, here's the company, we'll give you 100 grand, you know, to handle your administrative costs. Will you help the kid out? And then they still say no. Then do we know more?
I think that could be very telling. Yeah. But again, you know, there's got to be some way to override this whole thing. Somebody could. It seems to me that the head of Health and Human Services or somebody could override this company.
Kathleen Sebelius got in big trouble, but you know, telling one kid for I can't remember exactly, but it was Kathleen Sebelius denying one little girl a transplant. Remember that a few years back, and she caught. She was overruled. She was overruled by a judge, I think, and that kid's life ended up being saved.
This PR company, if they have a PR company, they need to come out in a press conference and say, this is the reason why. Right now, we just got, we're going to delay the process. Again, we need to know solid facts before you just throw it out there that we can't help this child. I mean, that's just wrong.
Yeah, because right now, look at what we're doing. We're speculating on what could be going on. We're not pharmaceutical reps for by any stretch of the imagination. But I do know there is such a thing called clinical trials. Why can't this child be incorporated as far as further research into further clinical trials?
Exactly. There's not an existing clinical trial for this particular product.
Well, create one. I mean,
yeah, but could you create one in time to save this particular child? There's so many questions. There's so many unknowns out there. We just, you know, we don't know.
I just think that this company, it's bad public relations. I think the company should try to save this child. It's one child, but it could be your child, or my child.
And, and just in case we're tempted to believe this is one of those huge conglomerates, this is a company of about 50 employees, and they're contending, look, we're a small pharmaceutical company. If we dedicated all of our personnel to handling this child's request and the successive requests that are coming, we believe that our time would not be spent in getting this drug to market where it can help a vast majority of kids out. And that's another part of the reasoning.
Well, if they have success with this drug, this story, if this child dies, will always haunt them. You know it will. It'll
Just
always come back.
make an exception. Give the kid the drug and cut out all the you know, the paperwork and all the red tape, and just give it to him and then make it available.
If it works,
best case scenario.
If the drug works, then they're the heroes.
Yeah.
If it doesn't, what does it do to the sales of that drug when they do roll it out? I'm sure that every bean counter in that company and some of the researchers are doing exactly what we're going to go, what if it'd be a PR nightmare. All right, it's back by popular demand. The Daily Paper Route. Coming up, you know what? I got here before this was, you know,
me too.
After this had been in place. So
it's so much fun. You guys are going to love it.
Oh,
this is the best part of the program.
This is great. The Paper Route returns, and we're doing it next.